Now we are going to discuss about renal calculus. What is meant by renal system? Kidneys, ureter, bladder, urethra. Calculus. Anywhere in the renal system, if the calculus is present, it is called renal calculus. This is the simple most definition, and I will make it more simplifier. Okay, what are the pro factors which will contribute to the formation of stones? In males it is more than female in second to third decade of life. See, why males are more affected than female? For everything I will tell why it is like that. In males there is testosterone, in female there is estrogen. This testosterone is act like pro to stone forming. This estrogen will inhibit the stone formation. Okay, why? Because there is oxalate, and this oxalate and citrate is there. That combination is broken by the estrogen. Okay, those are all deeper biochemistry we did not need here. We don't need here. Just remember that testosterone is pro stone forming and estrogen is inhibiting the stone formation. So we can see females are less prone to these stones. Okay, now it is good. Okay, why in second to third decade of life? See, in second to third decade of life, this is the place more hormonal changes occur in the body of both males and females. That is the first thing. And second thing, this is the age where persons will engage in different activities. That is, they will go to military service, or they go to some stressful jobs, or they go to some random jobs, daily labor. That stressfulness is there, right? So those all contribute for endocrine related systems, and those will contribute for the stones in this age. Okay, then in males, relatively male will intake more proteinaceous food than female. Okay, if it is the case, the male will have stones than female. Okay, it doesn't mean that female don't have stones. Female also will have stones, but less common. Okay, till now what we had discussed the definition and also the reasons why it is happening. Okay, now next. Okay, stones are happening. How through what those stones are made up of, we'll see now. There might be calcium stones, there might be uric acid stones, there might be oxalate. Okay, before telling what are the types of stones, I will tell one more concept for you. Phosphate. Okay, I did not tell why the stones are forming, right? I told the factors which are pro to formation of stones, but why? See, in that pro also why they are happening. And citrate, magnesium, pyrophosphate. See, these are the elements which are present in the urine, but if these are increased, they are pro stone forming. Means if these are increased, they might lead to formation of stones. But what happened, these are the red citrate, magnesium and pyrophosphate. What these do, they keep this stone forming in control. That means these are inhibiting these from forming stones. Okay, now if in case if these are increased and these are in the normal level itself, one is increased and one is in normal state, then stones will be forming. Now if the definition goes like this: if the concentration of stone forming elements and these are inhibitors lose the balance, leads to stone formation. If there is an altered balance between these, it might lead to stone formation. This is a general concept. Okay, now what we have to discuss, okay, I'm from that time I'm telling they will be increased, they will be increased, they will be increased. Why they will be increased, that one only I will tell. Mostly we can see four types of stones. Those are calcium stones, more probably calcium oxalate stones. We can see uric acid stones. We can see cystine stones. We can see struvite stones. These are the major types of stones we can see. Major type of material which are forming the stones. These are the major types. Okay, now the material we know. Then what we'll discuss, where the calcium will increase and where it can cause formation of stones. 50% idiopathic hypercalciuria without hypercalcemia. See, there is no increase in calcium levels of the blood, but there is increase in calcium levels of the urine. That is idiopathic, that is we don't know the cause, but without increasing the without being increase in the blood, it will increase in the urine. That is a 50% of the cause we can see. And these calcium stones are 70 to 80% out of this total 4 calcium stones are more occurring. Okay, this is the 50%. Then 25% idiopathic, we don't know the reason why they are forming, and 15% it is hyperuricemia without increase in uric acid level of blood. In the blood there is no increase in uric acid level, but hyperuricemia is occurring. Okay, this is the 15% it might contribute. And without effect of metabolism of calcium, see, this 15% of the conditions will not affect the metabolism of calcium. In the blood uric acid levels will not be increased, but hyperuricemia is there. Okay, this is the 15% conditions. Then 10% hyperparathyroidism. Due to hyperparathyroidism, more calcium, bone resorption, bone calcium will come from bone to blood. Okay, more calcium is present in the blood, so that hypercalciuria will be happening. That means here there is hypercalcemia as well as hypercalciuria. And one more, in this 15%, absorptive calciuria. That means from the intestine more calcium is absorbed. That is absorptive calciuria. Okay, here we completed 50%, 75, and 70, 80, 90, 100. Okay, these are the total distribution. Mostly like this only they will be there. And then we'll discuss about the uric acid stones. See, after discussing about every stone constitution, we'll know about how they are formed, means how the process goes on. Okay, uric acid. If due to some reason like gout, if uric acid is increased in the blood, it might lead to uric acid stones. Okay, it is very simple. Okay, here one important concept, important concept is there, that is, if your pH is 7, if the pH is 7, the solubility of this uric acid will be 200 milligrams per deciliter. But if the pH is falled to 5, then only 15 mg per dl. The solubility is decreasing, right? The solubility of the uric acid decreasing, so in the lower pH it might lead to uric acid stones. And struvite stones, see, there are some bacteria like Klebsiella and Proteus. What this do, they produce urease. This urease do urea. Okay, this urease split this urea into ammonium. This ammonia makes alkaline pH. Okay, due to this alkaline pH, why ammonia is produced actually? Because in these struvite stones, okay, before that I will tell one more thing. Why struvite stones are caused? Because due to some underlying bacterial infection, they, like Proteus and Klebsiella, they might produce urease, which split the urea into ammonia. It make alkaline pH and form stones. Okay, what are the constituents of the struvite stones? That is magnesium, ammonium, calcium phosphate. Okay, these are called struvite stones, also called triple stones. Why? Magnesium, ammonium, calcium phosphate, 3 are there, right? So it might also be called triple stones. What happening in these struvite stones? First, preceding bacterial infection which produce urease, which leads to alkaline pH by the formation of ammonia, and then lead to formation of magnesium, ammonium, calcium phosphate stones. Okay, we now understood about struvite stones also. Then now I am telling how, means why they are formed. Okay, what are the mechanism behind their forming, I am telling. And this cystine stones, this is mostly genetically acquired disease like this one. Transport of cystine is altered. Due to transport is altered, what happened? Cystine accumulate. Okay, and the story is same, the stones will form. Okay, this one also finished. Now we understood about how these 4 types of stones are formed. Okay, this is also very good. Then what? See, let this be calcium, let this be uric acid, let this be struvite stone forming material, let this be cystine. This will first form nucleus, means some part will aggregate, very some part. This is called the nucleus. After this, around this, the remaining, if suppose this is calcium, the remaining particles will come and surround like this around that nucleus, around that small stone forming. Like after that aggregation, all these small particles will aggregate and form big stone. This is the process how the stone is formed, any stone. Okay, this is also finished. Now talked about we talked about calcium stones, uric acid stones, then struvite, then cystine. Okay, we discussed all this. Now we'll know about the morphology, how they look. Morphology of the stones. Okay, draw this table and I will make it very easy. And you can write in order also if you can't remember any of the points. See, first calcium stones are dark brown. Why also I will tell. Don't get frustrated or confused. Uric acid stones are yellow, brown, yellow to brown. Struvite stones are yellow, white, and cystine stones are yellow. See, when a calcium stone is formed, this stone is how, see, what are the calcium involved structures in our body? Bone, teeth, how they are hard, right? So we can write here hard. Okay, we had written here hard, and the surface will be rough. This one calcium oxalate. Okay, why the surface is rough? Because if this is a calcium stone, the cystine molecules will be like this, somewhat making it like needles, like glass pieces, like it will be. Okay, it is oval shaped stone. What happens if this is a urinary tract? If it is traveling like this, while it is traveling, this sharp edges might cut this, and blood will come out. And the blood which had come out will attach to this, and gives it dark brown color. Okay, that is the mechanism behind this dark brown color. And it is hard because calcium is anyway hard, and it is rough because oxalates are projected like this, and it takes shape of oval shape. It takes oval shape. And then why it is yellowish brown? See, normally urine can go from yellow to red color also, according if we don't take water properly. Normally it is yellow only. Okay, if that is the range which we had given to uric acid stones, the color range, that is yellow to brown. This is normal color only. And struvite stones we had given yellow white. Why? Actually these are also called dirty white stones. Actually this struvite stones, what I told, following protease or Klebsiella infection which release urease, they are okay. This urease will lead to formation of ammonia by splitting urea, right? Okay, these are following an infection, right? So these are following an infection. So this yellowness is coming from the preceding infection damage. In the preceding infection due to this protease and Klebsiella, there is damage in the tissues. So that yellow color, that dirt is taken up by this struvite stones. Actually this magnesium, ammonium, calcium phosphate, the material is there, right? It is white in color, but this yellow color is coming from this degraded particles. So it can also be called dirty white. Dirtiness is because of those degraded materials. Okay, this one. And cystine stones are amino acid which take generally yellow color. And okay, this one is hard, rough, oval. Okay, we finished calcium stones. And these are very small. In overall 4 stones, only this is large. All are small. All are small stones. You can write directly small. Okay, in this uric acid stones, these are smooth. Here there is no oxalate, right? Only uric acid will take a smooth surface, okay, which gives it smoothness, small, yellowish brown. And cut, when you cut on section, if you cut it, you can see laminated appearance. See, whenever see, when you did you ever see the lamination of important documents? They will be somewhat some shining will be there, right? So that is won't probably mean that, but it's somewhat like that only, like somewhat brighter shine, like that one laminated appearance on section. Okay, we finished uric acid stones also. These two white stones, very important stones. These are shape of stag horn, that horn of the deer, horn of the deer, stag horn appearance. Why it is getting stag horn appearance? Because in the kidney it will accumulate and take shape of renal, pelvis, and major and minor calyces. These stones get accumulated and take the shape of renal, pelvis, and calyces, so that they get this type of shape somewhat. So they are called stag horn appearance, like the horns of the deer. Okay, does it have any particular shape? No, right? So irregular shape, and they are soft. Okay, see, then we also finished this, and we can write here what I told. These are the only stones which are large. These are all are small. Okay, then cystine stones. This cystine stones, what I told, though it is genetically acquired disease, right? It is due to accumulation of that cystine particles. It is yellow, small, and waxy. Why it is waxy? Because of amino acids. Because it is formed by the amino acids, it is waxy. Okay, we now understood the morphology of everything. See how easy, right? This one, if you write along with me, you can prepare from that notes only. Now we'll discuss about the clinical features. Okay, clinical features. Colicky type of pain. Wait, I'll tell you. This is the body, right? If you think this is the back region, kidney there is. Okay, from here it radiates towards a these are flank region to groin region to genitals. Colicky pain, how it travels? It travels from flanks to groins to genital. This colicky type of pain is characteristic feature of renal stones. Okay, from the kidney region it is coming to flank region, then to groin region, then to genital region. This is called colicky type of pain. Okay, and there is hematuria. Why? You already know, because there is rough surface. If it obstructs or cuts the epithelium, there will be hematuria. You already know it. And complications. What are the complications? There might be hydronephrosis. There might be pyonephrosis. There might be obstructive nephropathy. There might be renal failure. Hydronephrosis is, see, if this is the kidney, if the stone is here, this kidney will bulge due to urine. That is hydronephrosis. And pyonephrosis is same thing. If the stone is there and due to this stone the urine is retained, the urine retention takes place here only. So the bacteria which is there, if those are pyogenic bacteria, this kidney might be filled with pus. That is pyonephrosis. And obstructive nephropathy is this one, obstruction, and it is leading to nephron disorder, kidney disorder. So it is obstructive nephropathy, and progressively it might lead to renal failure, and it can also lead to recurrent urinary tract infections. Okay, due to blocking. Not only here, it might be in ureter also. It might be inside the glomerular region also. Wherever it occurs, it might, if it stops the passage of urine, it might end up in recurrent UTI, hydronephrosis, pyonephritis, obstructive nephropathy, and renal failure. Okay, these are all the important points about the renal calculi. If you like the video, share it to your friends.